डिस्कवरी तक है ट्रैफिक कमिंग टुवर्ड्स JLT. ड्राइव सेफ, सुनते रहिए.
This is Talk 100.3.
9:45 on the clock. A very, very good morning to you. Right now, it is time that we introduce you to Dr. Bahareh Bazooyar, a specialist neurologist in Canadian Specialty Hospital. Now, there is a new method of therapy in a lot of, psychiatrical and neurological disorders that this is for. This is an FDA-approved therapy that has just been released. And to talk to us a little bit more about this, we do have the doctor on hold with us. Good morning and welcome to the show.
Good morning. How are you?
Very, very well. Could you talk to us about the new method of therapy for lots of psychiatrical and neurological disorders that has also been FDA approved?
Yeah, sure. I hope you are doing well. And I'm Dr. Bahareh, a specialist neurologist in Canadian Specialist Hospital. This is the new method of therapy for lots of neurological and psychiatrical disorders. It's RTMS, repetitive transcranial magnetic stimulation. It's a non-invasive procedure that uses magnetic field to stimulate a specific area of the brain. It has been studied as a potential treatment for lots of disorders such as depression, anxiety disorder, obsessive-compulsive disorder, Parkinson's disease, migraine, tic disorder, autism, addiction, stroke rehabilitation, and also chronic pain. The use of RTMS for this disease based on the neural activity, and it can improve and neural activity by stimulation and also inhibition. So, and it can modulate activity in a specific area of the brain, and it can improve the quality of the life. And also, recent researches show that it can improve performance in athletes. They can do their maximum effort, and it can also regulate their emotional and balance, so they can do their best in the competition. The therapy, now I want to explain a little about how it works and how we can, for example, do this therapy. It's very simple. It has a coil that transfers magnetic field inside the brain. The patient can sit in a comfortable chair. There's no need to hospitalization or anything, and they just relax. There's a cap. We put a cap on the head and we do some measurements. According to the signs and symptoms of the patients, we can stimulate and also inhibit a specific area of the brain. It's like a session, like, for example, physiotherapy for the brain, and each session may take around half an hour. The patients don't feel any pain, just they feel a little tingling and clicking sound. After the therapy, they can go straight forward and do their routines, their job, and they can drive. And the sessions should be minimum 20 sessions, but they can do also maintenance therapy. And it has FDA approved for migraine, depression, and anxiety. But it has definite effect for motor improvement and language after a stroke disease. I'm very happy to be with you, and if you have any and if you need any help and assistance, feel free to contact us.
Right. Doctor, we have a message that has just come in. It says, will the therapy help epilepsy?
Epilepsy, it's risky, I have to explain, because, the inhibition can treat epilepsy, but because one of the side effects of the RTMS therapy is seizure, but not in all people, in the patients that has a history of seizure. It's better not to do in these patients, okay? And also, it's contraindicated in patients that have metallic device because it's a magnet. For example, the patient that has artificial heart valve or like clips and coil in their brain, not, for example, trauma and, for example, some pins and that we use for example, fracture or these things. No, just for artificial heart valve and some a specific metallic device that they put in the brain. And bullet fragment is contraindicated in these patients.
Well, thank you so very much, Doctor, for taking time out and educating us, especially with this new therapy. Thank you, and we wish you all the very best.
Thank you so much. Thank you. Have a nice and great day.
You too. Bye.
Bye.
A powerful story of a soldier who unleashes the fire within. Ruslan, starring Ayush Sharma.
मेरी फाइल का कुछ हुआ?
तुम सिर्फ एक एसेट हो रुस्लान. Remember that.
An action-packed, powerful screenplay directed by Karan El Bhutani and distributed by Fun Asia Films. To win invites to the special screening of Ruslan on